Hello and welcome. Today, we're discussing a serious, yet often overlooked, lung condition: foreign body aspiration of the lower airway. We'll delve into what causes it, how it affects the lungs, what symptoms to look for, how it's diagnosed and treated, and importantly, how it can be prevented. So, let's get started! Foreign body aspiration occurs when an object, usually small, is inhaled and lodges itself in the lower airways, specifically the trachea or bronchi. In children, common culprits include food items like nuts, seeds, popcorn, and small toys or parts of toys. In adults, it might be poorly chewed food, pills, or dental appliances. Factors increasing the risk include impaired swallowing mechanisms due to neurological conditions, altered mental status from drugs or alcohol, and underlying esophageal disorders. Essentially, anything that hinders proper swallowing and airway protection can increase the chances of aspiration. Once a foreign body enters the lower airway, it triggers a cascade of events. The immediate obstruction can cause partial or complete blockage of airflow to the affected lung area. This leads to air trapping distal to the obstruction, potentially causing hyperinflation. The presence of the foreign body also irritates the airway lining, leading to inflammation, edema, and mucus production. Over time, this inflammation can result in pneumonia, bronchiectasis, a permanent widening of the airways, or even lung abscess formation. If the obstruction is complete and prolonged, it can lead to atelectasis, or lung collapse, and potentially respiratory failure. Foreign body aspiration is most common in young children, particularly those between the ages of 1 and 3. This is because they are still developing their swallowing coordination and have a natural tendency to explore objects by putting them in their mouths. Among adults, the incidence is lower, but it can occur in elderly individuals, people with neurological disorders, or those with compromised gag reflexes. Statistical data varies, but it is estimated that thousands of children are treated in emergency rooms each year for foreign body aspiration. Highlighting the significance of this condition, the signs and symptoms of foreign body aspiration can vary depending on the size, location, and degree of airway obstruction. Sudden onset of coughing, choking, or wheezing is a classic presentation, especially in children. Stridor, a high-pitched whistling sound during breathing, can indicate upper airway obstruction. Other symptoms may include difficulty breathing, shortness of breath, cyanosis, a bluish discoloration of the skin due to lack of oxygen, drooling, voice changes, and fever if pneumonia develops as a complication. Importantly, symptoms can sometimes be subtle or delayed, especially if the obstruction is partial or the foreign body is small. Diagnosing foreign body aspiration requires a high degree of clinical suspicion, especially in children with sudden onset of respiratory symptoms. A detailed medical history, including a witnessed choking episode, is crucial. Physical examination may reveal decreased breath sounds on the affected side. However, imaging studies are often necessary to confirm the diagnosis. Chest X-rays can sometimes visualize radiopod objects, but many foreign bodies are radiolucent and not visible on X-ray. Bronchoscopy, a procedure where a thin, flexible tube with a camera is inserted into the airway, is the gold standard for diagnosis and often allows for simultaneous removal of the foreign body. While there aren't distinct types of foreign body aspiration in the way you might classify pneumonia, we can categorize them based on the location of the obstruction at trachea vis bronchus, left vis right lung, the type of object aspirated, food a vis, none, food, and the degree of obstruction, a partial vis completa. Each of these factors influences the specific symptoms, treatment approach, and potential complications. The primary goal of treatment is to remove the foreign body from the airway. For complete airway obstruction, immediate intervention with the Heimlich maneuver is crucial. Once the patient is in a medical setting, bronchoscopy is the preferred method for removing the object. Rigid bronchoscopy is often used in children because it allows for better control on larger instruments, while flexible bronchoscopy is commonly used in adults. After removal, supportive care such as oxygen therapy, antibiotics if pneumonia is present, and bronchodilators to open the airways may be necessary. Prevention is key to minimizing the risk of foreign body aspiration, especially in children. Keep small objects, such as coins, buttons, and small toys, out of reach. Cut food into small, manageable pieces. Supervise children closely during mealtimes and avoid letting them run or play with food in their mouths. Encourage slow, careful chewing. Educate caregivers on the Heimlich maneuver for children and adults. For individuals with swallowing difficulties, speech therapy and dietary modifications can help reduce the risk. The prognosis for foreign body aspiration is generally good if the object is removed promptly and without complications. However, delayed diagnosis or complications like pneumonia can worsen the outcome. Recent research focuses on improving bronchoscopic techniques for foreign body removal, particularly in challenging cases. There is also ongoing work on developing better imaging modalities to detect radiolucent foreign bodies more effectively. Newer, smaller bronchoscopes are also being developed to allow for safer and more effective removal in infants and very young children. Continued research and awareness are crucial to improving the management and outcomes of foreign body aspiration.